Hi guys, welcome back to my channel. This is Abbas Ali, full-time practicing orthopedic surgeon, a part-time YouTuber and orthopedic faculty. So let's discuss this quiz over here. This is an X-ray showing you the elbow. So let me label the bones for you. This is your humerus and this is your radius and this is supposed to be your ulna. Now there is a fracture here. And you've guessed it right, it is the fracture of the humerus. And where exactly? Somewhere around the supracondylar region. So it's a supracondylar humerus fracture. So the question clearly mentions here that a 9-year-old boy came to my OPD with pain and swelling. Above X-ray was done. So now strategically this question is not mentioned that it is an elbow, so that you have to identify the anatomy of the X-ray over here. So it's an elbow obviously. Now the first question is, what is your likely diagnosis? So the question is asking your diagnosis. What could be the diagnosis? Exactly, it is a supracondylar fracture of humerus. Now once you've established this diagnosis, there are many things that come to your mind, right? So don't go ahead, let's look at the question. Second question, what is the classification? Now what is the classification for supracondylar fracture of humerus? We have a classification called Gartland's classification. It is divided supracondylar humerus fracture into 3 types: type 1, type 2 and type 3. In type 1 supracondylar fracture of humerus, the fracture is an undisplaced fracture, whereas in type 2 there is only a break in the anterior cortex and the posterior cortex remains intact. And in type 3, it is a complete fracture with a displacement. So the X-ray over here is your type 3 supracondylar humerus fracture. The third question is, which is the most commonly injured nerve? Now this is very important for your exam. The most commonly injured nerve is your anterior interosseous nerve. If that is not given in the options, then you can go for median nerve. So anterior interosseous nerve is the most commonly injured nerve in supracondylar fracture of humerus. Now looking at the fourth question, what is the most common long-term complication? You see, the most common complication or the most common long-term complication of supracondylar humerus fracture is malunion. And which type of malunion? A malunion known as cubitus varus, also known as gun stock deformity. A very important image-based MCQ for your upcoming exams. So these are the answer to these questions. I hope I've helped you. Take care. Bye-bye.